When we talk about mental health, we often focus on the stigma held by people. But what about structural stigma? Structural stigma is the systemic neglect of people with mental illnesses within our healthcare and societal systems. In other words, it's the stigma held by our institutions. Why does this matter? Well, 1 in 7 Southeast Asians live with a mental health condition. Yet, many are not receiving the treatment they need. And if we only tackle individual stigma, we miss the bigger picture. Policy and governance issues that create huge systemic barriers for people trying to access help. Let's take a look at 3 major examples of structural mental health stigma in Malaysia. First up, compared to physical healthcare, there's a significant shortage of mental health care professionals. The WHO recommends 10 psychiatrists for every 100,000 people, but in Malaysia we have only 0.8 per 100,000 compared to Singapore, which has 4.6 per 100,000. This means that one psychiatrist in Malaysia could be managing over 2,000 cases. The implications? Long waiting times, inadequate care, and many individuals falling through the crack. With nearly 1/3 of Malaysian adults suffering from a mental health disorder, we clearly need to do better. Next, we need to talk about funding. The WHO suggests that upper middle income countries like Malaysia should invest at least 2.4% of their health budgets into mental health. But in budget 2024, only 0.89% of the healthcare budget was allocated to mental health, a decrease from 1.11% in 2023. We see a similar pattern across ASEAN, with mental health expenditure ranging between only 1.1 to 2.9% of total healthcare expenditure. Insufficient funding means fewer resources, limited programs, and an overall lack of prioritization for mental health. This ultimately leaves more people in need without the treatment they deserve. Lastly, let's address the issue of criminalization surrounding mental health. The criminalization of suicide was a huge barrier that prevented many from seeking help due to fear of persecution. Fortunately, this law was repealed last year, but there are still issues to address. In particular, those dealing with substance use disorders face heavy penalties. Despite the recent amendments to the Drug Dependence Act, many leading drug policy experts have argued that these are insufficient in holistically addressing the structural stigma surrounding addiction. The Dangerous Drugs Act continues to impose hefty fines and potential imprisonment for those affected. Criminalizing substance use not only discourages people from seeking help, but also fails to provide the necessary support for those struggling with addiction. Despite all this, Malaysia is making efforts to address these issues. The National Strategic Plan for Mental Health is a great start, outlining targets for improvement and creating accountability within the government. What's more, emerging NGOs such as Nyawa, MIASA, and the MMHA are taking steps towards creating progressive mental health reforms. However, we still have a long way to go. Malaysia needs to expand the workforce of mental health professionals, increase funding for mental health care, and shift the narrative around drug addiction to treat it as a public health issue rather than a criminal one. To enhance community care and well-being for all members of society, we must begin with breaking down structural stigma. Share this video to spread awareness about structural stigma and help create a more supportive environment for everyone. Let's make mental health a priority in Malaysia.